So if you could introduce yourself, please.
I'm Kazungu Rauben, an ETH research coordinator, and I am a master's student of applied human nutrition at Makerere University. Thank you.
Okay, could you talk a little bit about your childhood and sort of how you grew up and how that has affected you?
I grew up from a village background, say a poor background from Kisoro district, from southwestern Uganda. And when I was growing up, I was unfortunate because we used to have 1 meal a day, and having 1 meal a day would actually be a surprise. So I grew up from a poverty background, spending the whole day at school without a meal, and sometimes I would go back home and I would not find any meal, anything to eat from home. So it was really upset, so frustrated.
Wow, that sounds like it must have been really challenging for you.
Yeah, sure.
So how would you say that you overcame that and got to this point where you are today?
So my life has been so positive. I was positive about what I was doing, and I was so ambitious because my life was all about ambition. I am an ambitious guy. So when I was a kid, I wanted to be a doctor. So I was working towards that. Nevertheless, whether I was like spending the day without having a meal, that one did not affect me because I knew what I was looking for and what I want to be in the future. So at school, I used to make sure that I do better in class, and I used to be the best in classes. So my life is all about ambition, and I am a positive guy who believes that everything is possible if you can act.
Yeah, wow, that's amazing. And so how did you become involved with ETH? Can you talk a little bit about that?
So with ETH, I met the CEO, Jelly, 4 years back, when I had just finished my bachelor's degree, and he needed a research assistant who is conversant with botany, who can identify plants, and I was very good in that field. So I met him. I helped him do a malaria study in Namutumba district, and the research study was successful. So when he came back with the idea of helping people, because when we are outside there in the field, we would find so many cases, so many people are sick, but they don't have treatments. For those who try to go to the hospital, they go there, reach there, but they don't get treatment.
Right.
And at the end of the day, they get prescriptions to go and buy medications from the private care units, which is really absurd. So he was like, we need to come out with an idea. Why can't we start a health center? Maybe why can't we, start something to help people? And we shared the same dream. I bought it. I liked the idea.
Yeah.
And he was like, yeah, I've liked your idea. I think we should do it. So because of that, he was like, since we share the same dream, I think we should go ahead. If we get some resources, we should go ahead and start a health center. So that's how I met him.
Okay.
Yeah.
Yeah, it sounds like you're very bought in to ETH.
Yeah, I'm really bought in.
So what would you say, what do you think makes ETH special? Like, what's special about it?
So the special thing about ETH is actually identifying the need of the people.
Right.
That's the only thing that I like about ETH. You find the need of the people and you intervene and help the people.
Okay, and I know you touched a little bit on this already, but what would you say, what do you think is the biggest health problem right now?
I think here the biggest problem is health, and specifically malaria.
Okay.
So it's very high. Nevertheless, the intervention that the government is putting into place, but we are not yet there.
Right.
and there is high mortality, child mortality. It's very alarming. And despite the mortality rate, the treatment for malaria, sometimes the patients go to the hospital, and you reach there, you wait for the whole day, and you don't get treatment.
Right,
You go back home, the only treatment that you get is maybe say Panadol, a painkiller. You've not touched the disease, you've not touched anything about the patient, and you've just given the patient the Panadol. That's not working out. So malaria is really a problem that is affecting the communities of Uganda.
Right.
Yeah.
So how do you have any ideas for how to solve that problem and how to improve the situation?
So improving the situation is making sure that the drugs are in stock. You don't frustrate the patient when she or he comes to seek health care and he goes back home without being treated. That if
Right.
you can have treatment in stock
Right.
for the patients to access in case they seek health care, I think the problem can be improved.
Okay. And so, what kind of projects are you working on with ETH right now? And what project, I guess, do you find most exciting about ETH?
So I think I'm excited about most of the projects of ETH, but the project of intervening as a health center, I think, is the most outstanding project, because in Uganda, where we propose to have the health center, you can only find a health center 20 kilometers away.
Right. Right.
And from the interviews that we've got from people, they really get treatments.
Yeah.
So I'm thinking that if this project can go ahead, we establish the health center, and then people can have access to health care, which I think can improve people's life. Besides the poverty, really, people have surviving on one meal a day.
Right.
And when they go to the health units, they don't get treatment after spending miles traveling to the health center. So with ETH, I'm thinking that if we can have the ETH health unit in place, that project would solve most of the community's problem, because you can save people's life, people can work,
Right.
and they can save some money and buy some other basic needs, which I think can improve their standards of living.
Definitely. So where do you see ETH 10 years from now? Do you have sort of a vision for the future for this organization?
Oh my God! So I think I'm so ambitious, and I'm looking at ETH as a mega organization, actually. Because with the beginning that we have, and the hard work and the teamwork that we have, I look forward to seeing ETH being a mega organization,
Right.
having winning mega grants, helping the people, having the projects run into communities and improve the standards of the local communities.
Okay. Yeah, I think that sounds really great. I guess would also be interested to know, I guess, when you're not working on ETH projects, what do you like to do in your spare time?
I think I like floating on water.
Do you like floating?
I like floating on water, say swimming.
Yeah.
Yeah, I like swimming so much.
Okay, that's very nice. Well, Kazungu, thank you so much for talking to us. Do you have any other thoughts you want to share, or anything you want to say to our American audience?
So maybe the only thing that I can say is healthcare is a problem in Uganda. It's a problem in Uganda, and if it's not touched, I see many people quit this life. So I feel that someone who has hand can actually touch these lives. These lives can be saved if we can do something. And I think touching their lives is now. I don't see why we should wait for tomorrow. Time is now. If we need to do something, if we need to support these lives, then let's do it now and save it beforehand. Thank you.
Okay, thank you so much for talking to us.